Okay, welcome everyone to the kickoff for the Autumn 2021 Michael M. Davis Lecture Series. I am Keith Brown, the Administrative Director for the Center for Health Administration Studies, also known as CHAS. I'm glad you all can join us today. This Autumn Quarter Lecture Series will be entirely online for convenience and safety, but we are hoping to return to an in-person or possible hybrid format going forward in 2022. I'm very excited for today's lecture, as it has been over 2 years in the making, I believe. In a moment, today's discussion moderator, CHAS co-director and Crown Family School professor, Harold Pollack, will offer brief opening remarks and an introduction of today's presenter, the President of Vassar College, Elizabeth Bradley. If you have any questions, please type those questions into the Zoom Q&A pane for further answering. The chat function will be open later on in the discussion for questions following the presentation as well. We will do our best to answer all questions after the discussion between President Bradley and Professor Pollack. A recording of this webinar will be available on the CHAS website, as well as hosted on our YouTube channel, which can be found by searching for the Center for Health Administration Studies. And now Harold Pollack will introduce today's esteemed presenter.
Thanks so much, Keith. And I'll be brief in the presentation because President Bradley told me that her parents are not, in fact, on the Zoom call, so I can leave out a few things on the 50-page CV. But it's a special pleasure to introduce President Betsy Bradley today. We actually overlapped as graduate students 25 years ago on the Yale campus, when it was already clear that President Bradley was going to make major contributions. President Bradley started out at a school in Boston, where she actually, at Harvard, her honors thesis was on the economics of the contemporary art market, and then actually came to the University of Chicago and was involved in CHAS in its 1980s days, specialized in health administration and organizational behavior, and got a PhD at Yale, and has had a number of roles at Yale in both public health and in global affairs in a variety of ways. She was the Bradley Johnson Professor of Grand Strategy at Yale, and played a number of important roles, and has also written quite a bit about the need to balance our healthcare system with social services, with public health, and also has been a key leader in, of course, as President of Vassar during this COVID crisis, trying to navigate a major institution through these difficult times. So I very much look forward to the presentation. I'll be asking some questions, but I'm going to turn it over to you now. Professor Bradley, thanks so much for joining us.
Thank you, Harold. I love the introduction, and it does take me back to the ways we've intersected throughout our careers, and I'm an enormous admirer of you, so I really appreciate being here with you, and I'm looking forward to the conversation we're going to have. Also, shout out to Keith. I know how hard it is to be the administrative director of these kinds of programs, so thank you for all the work in preparing me and the others for today, so really appreciate that.
I left out one thing. You were also a co-author with one Colleen Grogan.
Yes, I was. Colleen and I wrote a paper or two together, a chapter. I hope you're here, Colleen. That was so much fun. Okay, so the title of the talk today is Navigating Perilous Times, Organizational Resilience in an Era of Pandemics. And as I say, I'm so delighted to be here at CHAS. So one of the things that's very special to me is that this is the Michael M. Davis Lecture Series. Having studied at the University of Chicago with Odin Anderson, Ron Anderson, David Dranov in the 1980s, as Harold said, and having listened to these lectures at CHAS, it was then part of the Booth School, Graduate School of Business, not part of the Crown SSA. But I went through all this, so I am so delighted to be here with you now, 35 years later, with a lot more experience in health management and health services and health policy research, in education, and now in my current role as the President of Vassar, navigating through a pandemic. Honestly, in the last 18 months, I feel like I have had to integrate everything I ever learned about all of these topics at once and use them. It's been a complete stretch. What I learned at Chaz, and it was really born of Michael M. Davis's illustrious career and so many others supported by Chaz, what I learned was really involving seeing the whole, intellectually recognizing and then emotionally accepting that everything is connected to everything else. Professor, I just want to ask, can you hear that outside my window or no? Hopefully not, because it's very loud here.
No.
Oh, good.
Good.
Okay.
You're good. Everything's good.
So everything's connected to everything else. And the implication of that premise is that how we organize our work really matters. Professor Davis knew this as he studied the most effective way at the Boston Dispensary to organize teams of physicians, nurses, administrators, and social workers in order to care for impoverished communities. And he did this in 1910 to 1920, guess what, right through the flu pandemic of 1918. In this context, I titled the course Navigating Through Perilous Times, Organizational Resilience in the Era of Pandemics. And I guess I'll start with the end. Why call this a time or an era of pandemics? And my thoughts on this are really twofold. The first involves the virus that causes COVID-19 is very far from the last pathogen that poses pandemic risk. It's much more likely a harbinger of times to come. Think about our risks. With our changing climate, the melting of the Arctic and the Antarctic permafrost, the human encroachment on rainforests and other natural boundaries. The path of research undertaken by Marani and colleagues at Duke is using historical data from 1600 until now. And with some fancy mathematical modeling, they suggest that under reasonable assumptions, the probability of extreme epidemics, so probably pandemics, can increase as much as threefold in the coming decades. Meanwhile, the degree to which our globe is prepared is just woefully limited. Experts have suggested that we should be investing far more in the surveillance testing of tissue and blood samples from animals where humans are at increased risk of zoonotic diseases, i.e. those that jump from animals to humans. And beyond that basic science, health policymakers have called for increased investment and coordination in data capture and communication about novel pathogens, exactly what we didn't have at the beginning of COVID-19. And then of course, we also need to advocate for the global governance to coordinate all those prevention and treatment efforts that we would know to do if we were in fact doing the ongoing data analysis and communication about potential pathogens coming our way. Unfortunately, as our global response to COVID-19 demonstrates, we have really not learned from previous pandemics, and there have been many. And the desires for national autonomy and personal freedom continue to blind us to the underlying truth that we are mutually dependent. In other words, everything is connected to everything else. Without global collaboration, humans are a very weak match for infectious, lethal microbes. So yes, we are in an era of pandemic, not just one pandemic. And I said my reasoning about this is twofold. So the second aspect of why I would call this an era of pandemic is that seemingly the infectiousness of deleterious social, economic, and environmental determinants of health is becoming more and more apparent. To be specific, the patterns of racism and social and economic exclusion are enormous threats to health. So much so that the CDC has called racism a fundamental driver of mental and physical health. And the American Public Health Association has called racism a public health crisis. And then we have climate change, which the UN has called a global emergency. And recent analysis published in The Lancet quantifies all this, indicating that climate warming is now causing 5 million excess deaths per year. Despite these challenges to human health on a massive scale, i.e. the perilous times, many global governance, leadership, and management structures remain unwieldy, conflicted, and ineffective. The scale is just too large, the constituents too diverse, and the objectives too multifaceted. This failure of coordination at the largest scale thus puts a premium on the lower level, more local structures. And I would argue that the unit of analysis for navigating the current moment includes organizations. By organizations, I mean hospitals, clinics, schools, community centers, firms of all kinds, even government agencies. Just as Ted Snyder in his book, Black Earth, elucidates the centrality of local efforts in saving Jewish lives during the Holocaust, so too might we consider the role of organizations in this era of pandemics. Given the uncertainty inherent in pandemics, navigation requires organizations to withstand buffeting, yet remain true to their mission. That is, this all requires organizational resilience, the real fundamental goal of this talk. So organizational resilience has been a topic of inquiry for decades in the field of health services research, social service administration, and business management. Note, these are not organizations that do not experience failure. Rather, resilient organizations are those that continue to produce outcomes of their mission despite the failures. The management theory on operating successfully in high-risk situations took an enormous leap forward with the analysis of nuclear plant disasters in the 1970s and 1980s, like 3 Mile Island. Particularly with the seminal work of Charles B. Perrow called Normal Accidents, a title that signals the paradoxical nature of organizational life, full of endless complexity of many moving parts that ultimately make accidents out to be normal. What does that mean? Well, it tells us that initiating events can be quite trivial, part of a normal day of work. However, to use Perrow's words, because of the system's complexity and its tight coupling, events cascade out of control to create catastrophic outcomes. It reminds us of the simple wedding parties, funerals before vaccination, which touched off major COVID-19 outbreaks. Perrow's work inspired a generation of researchers who focused on organizational systems that can confer or compromise resiliency. And by systems, I mean management and power structures, job designs, protocols, standard operating procedure, kind of the social norms at work. This work took the focus off the individual and what the individual may do to create resiliency or compromise resiliency, and rather placed it squarely on the larger system that governs interactions within the organization and between the organization and the larger environment in which it operates. And these systems theories were complemented by Carl Weick's provocative analysis of Man Gulch, published in 1993, the Man Gulch fire disaster, which identified the primacy of sense-making, or the ongoing process of creating order and making retrospective sense of what has happened. All this theory and research is super helpful. I've added to some of it, and I love reading the new as it comes out. I must say, in the last 18 months, anyone leading an organization, a hospital, a social service agency, or in my case, a college, had the opportunity to really bridge research and practice. Since March 2020, our organizational question of resilience at Vassar was how to continue to pursue our mission. Our mission is to provide the highest quality liberal arts education in a diverse and inclusive setting. How to do that while providing the health and protecting really the health and safety of our students, our faculty, and our staff. The empirical literature suggests a host of factors that lead to organizational resilience. And believe me, I was reading it. And we had a lot of those factors in place already. For instance, having adequate resources, material resources is key. So the endowment, colleges that had endowments or had assets that they could draw on or could qualify for Federal CARES Act. These are all sort of material resources that help an organization be resilient. Or creating alternative ways of working. So we had things we could do, hybrid classes, telework, again, made us more resilient under COVID-19. Or another factor is the ability to develop coordinating mechanisms. And we had two. One was our senior team, and the other was our Vassar Together, which was a frontline group made up of faculty and all kinds of frontline workers that was charged with taking the conceptual direction from our senior team. Something like our strategy overall was, we're going to make Vassar an island like New Zealand. We're going to get everybody here, test everybody, be sure everybody's negative, and then people stay on campus. This idea actually came from our history. It's one way Vassar got through 1918 as well. But the Vassar Together team would take that broad idea that came from the senior leadership and devise the implementation tactics that would work within our culture. And that meant these tactics had to be non-punitive. They had to be non-carceral. They had to work on social norm development. And our coordinating mechanisms were also non-linear, another characteristic of high resiliency organizations. That is, our coordinating mechanisms made sure they could be top down, bottom up, sideways in, and outside decision making. To some, I realize that this may sound like the Cohen and March garbage can decision making approach, and perhaps it was, but it worked. It added hours of extra work for all in communicating. We had an all college forum on Zoom every 2 weeks that everybody was invited to and came. We did it for 2 months. We also kept a dashboard online, which we updated daily. It required telling detailed and precise stories to each other, bargaining over new organizational powers, like who decides if a student is rusticated due to breaking COVID rules, creation of new jobs, like did anyone ever hear of a contact tracer that's employed by a college before? No. Or we developed a community care team that would help sort of work with those that were not abiding by staying on campus, et cetera, in, again, a non-carceral way. And this all required us pitching endless possible solutions, all at a heightened level of emotion and often on Zoom. Call it what you will, but it allowed us to practice organizational sense making and create meaning from thousands of disparate events. And in the end, we have had a very successful, knock on wood, 18 months on campus with mostly in-person education and very limited numbers of largely unconnected COVID-19 cases. These attributes, having enough resources, having a clearly articulated mission, finding alternative ways of working, developing coordinating mechanisms from the senior management to the front line, and having a practice of sense making are all paramount. All come from the literature, and now that I have lived them in practice, I am a believer and very thankful for all those who created that literature. But the truth is, they were not enough. I want to spend the last pieces of this talk describing what I see as an area ripe for more research and practice. That is the leadership task of managing paradox. For instance, based on open systems theory, leadership is a boundary management function, traversing the boundary between the inside and the outside of the organization. So between what goes on inside and how we relate to our external environment. At the boundary looking out where people in leadership stand, for example, at looking out at the climbing incidence of COVID-19 in one's region, one in the leadership role is expected to feel fear and yet transmute that into psychological safety on the inside so that the internal teams can learn and undertake creative problem solving. If they're too fearful, they can't learn. They can't take on those tasks of regenerating themselves and reacting creatively. So in that example, boundary management means endorsing both fear, is you need to be alert, I'm scared, we got to do something, and safety. Okay, we're going to be fine. You all just need to be relaxed and do some problem solving. That managing of that, I would say, paradoxical dyad of emotions is part of what I recognize as critical to our adaptation. Or another paradox. We have to oversee, in the leadership role, we have to oversee a community in which each individual needs to care for themselves. But they must also be exquisitely pro-social at the same time. At Vassar, we embrace the mantra, we precedes me, to drive pro-social choices, even at a time when self-interest and self-protection is at a premium and had to necessarily be front of mind. Living with apparent contradictions, like fear versus safety or self versus the community, requires mental agility, as one has to imagine opposite paths at the same time. I felt this intensively in the fall of 2020, when after 3 weeks of zero COVID cases on campus, our surveillance testing turned up out of the blue 7 cases in 1 day. Immediately, our collective brain went to the worst, the beginning of a major outbreak, lockdown, send people home. We'd been particularly courageous in the beginning, bringing all our students back, teaching in person, so an outbreak was really our biggest fear. It took some creative thinking to ask that we hold and check the tests for false positives. Then it took clout to get the lab to find the original samples, the original tissue and blood, and retest it. And finally, it took delicate negotiation at multiple levels of the lab and of the county to allow the lab to agree in writing that they had erred, and in fact, the cases were not positive. The occurrence of holding opposing explanations and conflicting emotions within oneself is what Voges, Rothman, Sutcliffe, and Weick have termed emotional ambivalence. Furthermore, they describe this as an affective foundation of high-performing adaptive organizations. I agree with this. They explore the paradox of hope and doubt, and that is the exact roller coaster we felt through the testing debacle. After this experience, I believe the heart of organizational resilience is the embrace of diversity. Diversity of ideas, diversity of perspectives, diversity of the levels of power. Yes, diversity of identities and histories, which we're very familiar with, but I'm referring to diversity in a much broader context as well. All of that embrace of diversity adds complexity to decision-making, but at the same time, that embrace is really a source of meaning that allows organizations to steer through danger. That is, to adapt to novel threats and opportunities while continuing to pursue the mission. Leadership in these contexts requires that wide embrace of differences in approach, flexibility to just toss out the old ideas and create it again, and a fierce holding fast to a vision that can align disparate forces toward collective action. So now to turn to Chaz and Professor Michael M. Davis. Both have imparted to so many an inclusive liberal arts approach to seeing problems, a perspective that we may call an ecologic gaze, from which we seek to see the whole. And we take our place in navigating this era of pandemics. We would do well in this time to invest in the resources to build resilient organizations and practice leadership with the humility that comes from accepting that everything is connected to everything else. Thanks so much for listening, and I'm really eager to hear your thoughts and have a conversation.
Thanks, I really enjoyed that. And please, folks, Keith can help us manage the mechanics of this, but if you have a question or comment, please put it in the chat. Let me start with a few basic things about your role as a leader, and then talk about some general policy things. One question: if you could get into a time machine right now and go back to the February 2020 you and say, I'm going to give you some strategic advice about some of the things that I learned. What would you say to your 2020 self, either about some things that changed your mind or just things that you learned that you would want, that if you had a time machine would have been really helpful to have somebody whisper in your ear 18 months ago?
Yeah, so Harold, can I answer this question from, I could have answered as the president of Vassar, but I thought you were going to ask me, what do you wish we had done as a country at
Oh,
that
that's coming. That's
Oh,
coming, I
that's
assure you.
coming? Okay.
You want to start with that one first?
Yeah, I want to
Is that
start
better?
with that
Go
because
ahead.
that drives everything. And we would have to roll ourselves back really to January when Dr. Tedros and the WHO called a public health emergency. And the job one that the US retrospectively, although I think that many in the US knew this at the time, but we didn't have a government that accepted this. What we really should have done is fully collaborate multilaterally with the WHO and China. And we just absolutely should have. The testing was already available. There were so many ways to squash this virus before it hit our shores in gigantic, uncontrollable, uncontainable numbers. And that's the way to deal with a pandemic. You have the outbreaks, but you blanket them. And the testing, the fact that the testing was available and we thumbed our nose to it saying, we don't really think this is a real thing. That was just an enormous, enormous mistake. So I think the collaboration globally was our first deep error. I would say the other thing that we absolutely did wrong ties to decades of underinvestment in our public health infrastructure and the ability to galvanize, mobilize resources quickly in an emergency for public health. You know, our public health system is made up of county level governments, and the public health person in the county is low man on the totem pole or low person on the totem pole. They usually really are not very, they're not in the news. Like, do you know who your public health professional is in your county? I doubt it. You know, county level government in the US is just not that strong. We think about the state and we think about our mayors and our governors, but we don't think about the county, and they don't have the resources to communicate. So between not having the testing strategy really for the country and then not having the communication to tell people we have an alert that would be memorable and believable, we were doomed. You know, COVID got the better of us, found a crevice and crawled right in. So I don't know, do you want me to try to think what I would do differently as in my job at that moment?
Well, we'll come back to that.
Okay.
But yeah, I mean, just one of the most striking things. So there are these YouTube videos by Barack Obama, George W.
Yes.
Bush, and Bill Gates, where each of the three essentially described how their greatest fear was that we were going to have a respiratory agent from East Asia that was going to start spreading in the United States. And when that happened, if that were to happen, here's what we have to do. And they basically outlined both the challenge and the required response and what we did not in fact do.
Yep.
And three very different people. I mean, COVID was not a very surprising thing. It was pretty much what a lot of people have been worried about for decades. How is it that a $4 trillion health system doesn't have enough $1 masks? I remember I was part of a policy conversation here in Illinois where they were trying to get PPE out, and there was a warehouse full of PPE. People were donating all sorts of resources, and there were two gentlemen who had a postage stamp machine that were trying to get the stuff out to UPS, and they literally could not put the postage on the boxes fast enough to get out to thousands of organizations some of the precious equipment that they had. And there's this sense public health is boring until it's not, and then it gets boring again. How do we change the political economy of public health so that resource imbalance is narrowed some?
Yeah, no, it's a great question. And just to go back to George W. Bush and Obama, particularly President Obama had a tremendous task force on preparedness for pandemics and had invested a lot, had done practice sessions, really had protocols, the whole thing. And the Trump administration actually disassembled it, completely dismantled that task force, a couple of years before the pandemic. So first thing is a centralized coordinating body that can be like a command room or situation room is absolutely necessary, did exist, and was taken apart. The other thing that was really difficult is in a pandemic, HHS, FDA, and CDC must work together. You know, FDA is obviously approving quickly vaccines, other things, medications, tests, everything. CDC has eyes and ears on the ground, has the data coming up, and HHS has the actual health service infrastructure, the providers. Those three agencies, if I'm remembering right, they all had new people and they didn't even know each other. So during the crisis times, I kept thinking we were going to hear about HHS, FDA, and CDC situation meetings and what their combined strategy was, but they actually were acting separately from each other or not in clear coordination with each other. Again, something that caught us at a time when our government was not in the health side working in a coordinated and experienced way. That's one thing. But how do we find ourselves in this? And you asked about the political economy, and I think it's just so important because honestly, these kinds of pandemics, they're like the 3 Mile Island thing. They don't happen that often, but when they do, they're complete tragedies. So people get tired of staying on alert. They fall asleep. And you know, the last pandemic that was quite as devastating was 1918, although there have been pandemics in between. And it's sort of funny to read back to 1918 and realize we just went through the exact same thing. There was fighting about masks. There was, you know, it's just the same thing. So why we don't learn and why there's not an incentive to learn, I think has a lot to do with markets, has a lot to do with economy. And has to do with what we really do. We value lives at what dollar value is actually a life, because it costs a fair amount to stay constantly prepared and ready for something like this. And it would save millions of lives. So that, you know, how much money is millions of lives collectively worth the way we make decisions? And I'm afraid we undervalue life very frequently.
Well, I remember I think that in some ways, I worry that our ability to reflectively learn the right lessons from this pandemic will be eroded by the sort of shambolic nature of the Trump administration. And I think that it tempts us to personalize the failures to the unworthiness of President Trump rather than look in a more structural, systemic way. And it would have been, if we had a replacement level president, to use the NBA jargon, for those of you that are sports fans, it would have been better, but many of the things would have similarly failed. And I remember I was involved in the stimulus debate in 2009, and I remember very clearly when Senator Collins took great pride in removing influenza preparedness from the stimulus bill, and basically saying public health preparedness is not stimulus. And there were hundreds of millions of dollars for flu pandemic preparedness. And if you look at the CDC's budget for pandemic preparedness, it has declined in a time when the overall U.S. healthcare system spending has exploded. And it is a bipartisan problem. It is that is worse for President Trump certainly exemplified the worst elements of that, but he's not the only bad actor. I mean, why is some of the failures at CDC that people have talked about? Why is CDC, in the arena of testing and many arenas, how can we improve the performance of CDC?
Yeah, and something related to the performance of CDC, they're one agency in a sea of agencies that they depend on globally. So the comments you were just making was about sort of the US failure, but I think there's also this other failure of how the US is just one player in the globe. Even now, I fear for this greatly. We will get the pandemic under control for a while, but look at the rest of the globe, and the virus is still replicating billions of times a day. So how do you really do that? And so some of the CDC's failure is its mutual dependence on others that also are underfunded. We could absolutely look at the CDC and say it is 100% underfunded, but people have been saying that for 50, 100 years. Always public health in the United States is not thought to be as protective somehow as my own medical care. I'll pay a lot for my insurance, but I will not pay my taxes to go to some unidentified life-saving thing out there that maybe I'll need or I won't need. Very, very tough. So they face two problems: the legitimacy from our own populace, who may feel like medical care is better for me than some anonymous CDC. And the second attack of legitimacy is from the globe. We often, as a wealthy country with a great CDC, feel that actually we should kind of drive global health and we should drive the WHO. We fund lots of the WHO. And yet we're not, at the end of the day, that collaborative. We'll do it in a bilateral way, but we're not that collaborative, for instance, with China's CDC. Haven't figured out, scientists will be collaborative, but politicians not so much. And the political economy, I think, says everything about that.
Just a couple of things on that. The WHO budget is 1/5 the size of one US hospital system.
Exactly.
Which
$4 billion a year. Simple.
And so, when you talked about resilience, as you mentioned, resilience requires resources, and they just don't have it. One thing, even from a totally selfish point of view, there are about 25 million people who go back and forth across the US southern border. And the idea that we can contain the COVID pandemic in the United States and just allow it to ravage South and Central America is just completely naive. We're one epidemiological system, and variants will emerge and whatever else will happen. Not to mention, if there happens to be a just got out there, we might be in even more trouble. So that component is certainly striking. By the way, there's some questions in the chat. One question that comes from Professor Seitz. It may be wishful thinking, but it's possible that several years from now we will be post-pandemic, whatever that might mean. If so, how will you know what you've learned, organizationally speaking, from the past 18 months? How will you know which of those will or won't apply to the new context?
Yeah, that's a great question. I think that's one thing that research gives me some comfort on as I tried to summarize the research on organizational resilience. I think there are some general factors that people have seen pattern after pattern after pattern in many domains of emergency response and resiliency sort of work. The bit about emotional ambivalence and managing paradox, I think that literature is very young. Kate Sutcliffe is really adding to it. Carl Weick, of course, Vogus, but I think that literature is very young, and I'd like to see it developed and talked about a lot more, because I think we could really train for that. And I think when you think about training astronauts or training flight pilots and whatnot, they've got to get this emotional ambivalence. They've got to be able to be very agile back and forth between a disaster and like, okay, we're okay. And I'm not sure the rest of us have really got that kind of training quite as well. And I do think that's a place to that we got to learn and then maybe put in our educational systems for people who are going to lead.
One question I also wanted to ask about, which is sort of a follow-on to Bill's question, is, the really looming public health catastrophe that even dwarfs COVID is climate change.
Absolutely.
And COVID has an action-forcing immediacy to it that climate change does not have.
Right.
And what are the lessons we might draw from COVID that would help us think about the looming catastrophe of climate change?
Yeah, the big lesson is we need to pay attention to it now and invest the resources now. We are making terrible cost benefit decisions right now because we can't see the future, but we've estimated the future. No estimate says we're fine. And I think that our short-sightedness, it just completely baffles all of us, I'm sure. The one thing I would say is the WHO is working very, very hard to try to collect together with the UN high-income countries and also middle-income countries like India and China to have a pandemic treaty. This is really right on the edge. They have a huge General Assembly meeting in November, really trying to line up political resources to have a global treaty to save us from pandemics. That mechanism, if that could be negotiated and signed, that mechanism could be a great example of what we could have in climate. Of course, we've been through trying to keep climate treaties, and with a democracy like the US, basically, highest very impactful in our global negotiations, and a democracy that, we're very good at instant problem solving, but we're not that good at planning and staying on the same plan. That's a tough thing, but I think that treaty concept and getting people to a place where they're scared enough that they know they've got to collaborate. And I guess I'll just end the answer to this item with going back to really, I think the theme of my experience in this talk is everything's connected to everything else. And when will we sit down and accept that? I think we still are the Americans of individualism that, hey, we can do it on our own, pull up your bootstraps. So different than what the reality and the scientific world is telling us. Scientific world is saying you are not an individual and you cannot do it alone. You must collaborate with others.
So one question, so I've said a bunch of things and you've said a bunch of things that are congenial to the kind of progressive policy analytic perspectives of most of the 51 of us who are on this call. It does seem to me that one of the reasons why public health has fared poorly in American democracy is that we in the public health community are not the most, we really have done a poor job of reaching out to many communities in the United States, and certainly politically and culturally conservative communities. We don't have the world's greatest cultural competence talking with them. And when I think about the disparate reactions in public health to the lockdown demonstrations and then the Black Lives Matter demonstrations, a lot of conservatives kind of stopped listening when they saw we kind of wagged our finger at the lockdown demonstrators, and then we said, well, racism is a public health issue, and we'll work with the BLM demonstrators to make it safe, but we identify with what they're doing. And I think a lot of conservative Americans, rightly or wrongly, said, oh, if you you treated these two different groups of people differently, I'm kind of checking out. How do we raise our game in American democracy to broaden it when you don't have someone like a George W. Bush in office who could be the ambassador to some of these communities? Which of course we didn't have.
Yeah.
What are your thoughts on that?
Yeah, well, I think that it's a little overstated. I do think if we try to connect public health, and it's the same as the BLM movement, and we get into more of a polarizing view of it. But if we really talk about public health as trying to create the environment in which you are going to live well and where humans are going to flourish, I actually think conservatives, low-income people, low-income white communities feel like, yeah, I want someone to help me with my childcare. I want someone to create a reasonable school. I want to actually have children and have them get a job so they can get food so they can live well. But I think our framing is often very mistaken. Some of the best work in public health, is like community health workers who live in these communities, come from the community. Really, they're doing public health in the poorest, and definitely a group potentially very conservative, sometimes church-based groups that are doing public health. They just need the jargon that goes with that community. And this ties very much back to something I said in my talk. When we had the senior leadership team making big decisions, like we're going to be like New Zealand, an island, we went to the front line to say, how do we say that? Like, what are the words? What are the things we need to do to actually make that work? And then they come up with, oh, you need a mantra, we precedes me, and we're going to have, this cool community care team. They put it in their social norm to take the strategy into their language. And I think when we're working with conservative constituents and we're working in areas that, they're not relating to the highfalutin principles of all this, they're relating to my kids are going to be okay. How do we, that's the creativity, is be embedded in those communities, going to the source, figuring out what is it that actually makes them feel like I'm going to be healthier now. I think it's the same strategy, but it's got to be wrapped in different things. It has to be wrapped in clothing that a conservative constituent is excited about. So
I think it also requires relationship that exists before the crisis. I mean, one of the things that we found in the early days of HIV, and you and I spending time in New Haven certainly experienced that you can't start a relationship in the moment of crisis. If you want to tell people, we really have to change. We have to have a safe sex message to reduce the spread of HIV. You can't say, hello, I've never talked to you before, and I'm talking to you now. And by the way, I want to change the way you have sex. You know,
Yeah.
that's sort of not,
Never
that's a
gonna
very
work.
difficult thing.
Yeah.
And that same need for prior relationship is true in every community. By that, we have a question from Colleen Grogan in the chat. On the point of organizational governance, I wonder what you think about restructuring the CDC. The CDC takes on a lot: violence prevention, community-based health promotion to infectious disease. Should we perhaps take down the public health divide, shift over more health prevention to CMS or some other entity, and set up a separate organization to focus on pandemics? Would you do any organizational change at CDC?
Yeah, Colleen, that's such a good question. I was hoping Harold wouldn't read it because it's such a difficult question, but now that he has, I do have some thoughts about this, of course, and I'd be curious for yours as well, Colleen. I think we have to be a little careful about not rearranging the deck chairs on the Titanic. And it's not clear the structural change. You'd want to know, are we doing cultural change when we're doing structural change? So it may be we need structural change, but I think we also need that legitimacy of the pandemic preparedness and the public health voice. It has to feel to our populace that, yes, we're going to invest in that now, whether it's under CMS, it's a separate thing, it stays within the CDC. So I've worried a lot about ideas of how to restructure without that more in-depth cultural, political economy conversation preceding restructuring. I don't think the structure alone will do it.
Here's a question from Bridget Davis. There's much skepticism about whether visions and missions are actually meaningful or simply functions of isomorphism decoupled from organizational action. However, it seems your narrative posits an incredibly clear vision and mission may be required to experiencing the emotional ambivalence you describe that allows for productive and creative problem solving. What advice would you give other organizational leaders, especially in social service organizations, about the possibilities of recoupling or more tightly aligning their mission within the decision-making required in a moment of crisis or disaster?
Yeah. Thank you so much for that. I think everything you've said is exactly correct. The advice I would give is get your mission down to something that you can say every day really easily over and over again. You never forget it. No one ever forgets it. It just always is. And we did augment our mission, which I gave as providing the highest quality liberal arts education in a diverse and inclusive setting, which I can say very easily. And I think most of our institution can. But we did augment it for the pandemic with one other piece, which I didn't talk about, and I do think is important. It helps ground it, and it even helps animate it if something can ground it and animate at once, which is our values. So we said from the beginning that we had 3 values going into this, and one was that we really wanted to protect our most vulnerable. We wanted no deaths. I remember sitting in my office and saying, okay, we got those employees out there who have COPD, obesity, and cancer. Nobody can die here. We are going to protect our most vulnerable. So that was just job one. And in fact, we decided not to lay anybody off because we knew we needed their, it was the right thing to do. And we knew we needed their support. So most vulnerable, really important. The second was equity. Everything we did, we tried to think, who are we sort of scapegoating if we do this? Who are we leaving out? Who are we excluding? So equity was very, very big. And the third was, we have a mission and we got to get that mission accomplished. And that is the mission I just said. So when I put the mission with the values, and one of the values is, this is our mission, it kind of, people got it, especially when it followed like protect vulnerable and equity, which totally people line up behind that. And then they're like, oh yeah, we need to do our mission. But I found it so helpful because there were many times that people were prioritizing safety to the exclusion of our mission. Like the safest thing is go home and don't come back. Don't anybody be on this campus. But how do you really give a high quality education in an inclusive setting when everybody's on their screens? You just can't do it. So then we'd come back and say, okay, that's not going to work. We're going to have to balance these different things. And I think it was because it was so grounded and inspiring from a values point of view that it was a lot more than an isomorphic effort. It was actually, I think it was an aligning feature of our work.
A couple of questions sort of about that. Well, one is, if you could go, as I started, if you could go back and give some strategic advice to the February 2020 you as president of Vassar College, what would be something that you would say, you know, this is very reasonable for you to try to do based on what you know now, but the October 2021 me can tell you actually you want to think differently about this. What are some pieces of
Yeah.
strategic advice you would have given your past self?
Yeah, so good question. I'm trying to think of which of the millions of things. You know, I think that I probably would have said to my old self, this is going to be really rough and you're not going to get anything else done at all. What you're going to do for a year is the same problem set, which is how to survive COVID. Because there were so many times where our whole team was just so exhausted and sick of it because we have so many visions of other things. And we did advance on in other ways, our climate work and our anti-racist work, but still, you know, it's just like, oh, haven't I finished this homework problem set yet? So I think having a little bit more support psychologically for the leadership team, having hire an organizational psychologist that works through monthly, that's it. We did have an organizational psychologist who helped us a lot during crises, but I would have just said, no, hire that person, maybe have them spend an hour a week with your team. Because the sustaining is what's tough. And it's not just intellectual, it's obviously really emotional. The other thing that I would say that I really learned, and I still am ambivalent about this, but during the worst of the times, I just thought I needed to be as transparent as possible. And I gave a really tough talk about our finances. And it scared the heck out of everybody. They were like, wow, you know, we're going down the tubes. And I think I'm just conflicted because in retrospect, it ended up because it wasn't as bad. They're like, this is awesome, flat salaries, no problem. Because, you know, I thought we were really going to have to cut. So maybe that was good, but I think it was also too nuclear in the sense of it was too painful. So really meting out your transparency. And again, this is paradoxical because of course you want to be transparent, but you also want to do it in a gentle, timed, appropriate, mete it out in the appropriate proportions way that you don't, you know, it's like that fear and safety. I was very fearful and sometimes I might have overshared that. So I might have said, you know, maybe don't be quite as transparent every minute would be something else I'd advise.
It somewhat relates to Suzanne Baber's comment and the question in the chat that sort of maintaining resilience and dealing with burnout. And I mean,
Yes.
certainly one of the things that we all saw was that there was just a huge burnout issue at every level. And you know, from senior leadership with the responsibilities of running an organization down to the
100%.
Yes. What are some concrete things that one can do to maintain the resilience of the front line? Like, I don't know exactly who the frontline people, there's so many.
We have frontline people. People live in the dorms, residential life, the counselors, the health promotion people. Yeah, no, the student leaders, burnout was a major thing. So we did have kind of a strategy for burnout. I don't know if you've read the book, Holding Fast. It's a great book, and given your job, Suzanne Baber, I think you would love it if you haven't read it. The name of the author, last name is Kahn, K-A-H-N, and it pitches that frontline workers are absorbing everything, all the emotion, everything. So you need to have weekly support sessions for frontline workers. And we worked on this, that our res life people would actually have an hour a week where they sat back, had, again, organizational psychologists and others to talk through what had happened. And that mere talking through made a huge difference. The second thing we did is we said, we're going to get to the summer and then we are going to collapse. The students are going to go home and our whole front line is going to take a big vacation. And we were really, really not easy on people, but like, go home. You've worked triple time the whole year. It's time to take as much time as you can to get yourself back together. And I think that really helped a lot too. But I still worry about it. I mean, we're still in the thick of it. People are still nervous. So burnout is something to really plan for. Yeah.
Yeah. One thing, by the way, that reminds me of in my own life, my wife and I take care of her brother who's intellectually disabled, and he lives in a group home. And many of the staff chose not to be vaccinated and had both tremendous burnout issues and also were resistant to some of the public health messaging that we were hoping people would embrace. And one of the things that people said is, this is a really crappy job. I get paid less than I would if I worked at McDonald's. I have no voice in the organization. And now you want me to get vaccinated, even though I'm nervous about it, because it would help the organization and my own clients, when it's not, when I have some real concerns about it. Not that and very few of these people were like hostile to the idea of vaccination, but they were nervous about whether the vaccine was safe. They didn't like Operation Warp Speed as the name. And they basically said, you know, I've never had a voice in my job up until now. And tell you what, if you really, you know, I'm basically, some of them said, I'm going to quit. If you make me get vaccinated, I'll just quit, and good luck finding someone to replace me right now. And this was very much not what I wanted to hear. And in fact, people were infected by unvaccinated staff members well into the, but at a human level, it was very understandable where that was coming from. And one nice thing about a place like Vassar College is you probably have a more humane way of treating employees than we do in a lot of social services.
Yeah, but I think that investment in the frontline employees and all the employees is so important. And one of our very first at Protect the Most Vulnerable is like, we are not going to lay people off who have low-level jobs here. Even dining, which we had grab and go, doesn't matter. You know, we didn't need as much staff, doesn't matter. We found other things they could do. And that investment was so key, because then they've all been much more supportive and like, oh, I at least have a job. And when it came to mandating vaccines, which we did do, we were able to work with the unions to get them to support doing that. And so we have like 98% are vaccinated now, and we have some who have, you know, medical reasons and religious reasons for exemptions. But I do think that investing in the front line is everything.
By the way, University of Chicago, I think, also stepped up for some of the hourly workers and some of the, you know, the dining hall workers who were actually often not direct employees of the university, but contracted. And people, that's what people are going to remember.
Yes.
You know, if you want people to be loyal to you, and to, you gotta step up when they care about you.
And they work so hard and do such good work. You know, the students depend on them. So
now, a question about sort of organizational resources. And I'll start with, so Vassar College is a well-resourced university. I think you have an endowment that's over $1 billion, something like that. What would you have done differently? Say you were the University of Chicago, you were the president of the University of Chicago, and you had you know, a significantly larger university. What are some things that a bigger university might be able to do that was beyond the scope of what you could do at Vassar? And I'm going to flip that around and ask about the smaller places. But
you know, one of the things I think the University of Chicago can do and Vassar cannot is the research. I was always in touch with my friends from Yale who are doing research that was literally figuring out, you know, how does contract tracing work? Where are we going to, what neighborhoods do we need the most help in? They can be much more, with that big research background, they can be much more in the dialogue of the country. Where are we going in this pandemic, as opposed to a smaller place that certainly do a lot of research, but the level is not going to be done in time for this pandemic. And that part, I think, is so important, what the universities really did in terms of advancing vaccine science, advancing our behavioral science about how people are understanding this pandemic. So that's what a larger place can do, I think.
And there were groups at Yale and at University of Chicago, and also who were doing epidemiological modeling.
So
were there aspects of that you found helpful or not helpful?
Yeah, you and I were talking about this earlier, but I use the Paul Thiel model, the cost effectiveness or Markov model, really, I guess. I don't know what kind of model you'd call it, but basically a set of inputs to drive decisions about if we decide to test weekly, and here's our expected influx, and here's our expected R naught, you know, how many cases could we expect? And we used that paper. I did end up critiquing the paper because his original paper, which David knows I feel this way in writing and in person, a good colleague of mine, that I felt that his paper was recommending you must test twice a week or you're going to be cooked. And my insight was, it's not one size fits all. If you're a college that can make the boundary of the college less permeable, which Yale cannot do because they're in the middle of New Haven, but Vassar could do, because we could say, actually, we can be pretty insulated here. The influx is much less, and therefore the testing could be lower, which is what we did. We tested once every 2 weeks.
And
we're
you
just
said, when you
finding
said you
that.
could maintain them, did you literally have, what does that actually mean when you said you can kind of seal it? When you said we want to
Yeah.
be New Zealand, what does that actually mean in practical terms?
Well, again, because we are totally non-carceral here, what
Mhm.
it means is we drove this social norm that you got to stay on campus as a student. And then faculty and staff could come on and off, but of course they're wearing masks, they're staying 6 feet apart. So what we were most fearful of is students who are living together, eating together, partying together. And what's the harm reduction approach to allow them to do that? Because they are going to party. So given that, how do we make them safe? And that was to keep the boundary. So we explained that to them intellectually. If you can keep this boundary, you're going to be much freer on the inside. So that was motivating for them. And then the other thing we did was bring in a lot of services. So we we didn't want to isolate our town, who would be bereft without all of the economic purchasing power of our students. So we brought services onto campus in a very COVID-friendly way. So students really almost brought the town onto campus, Munchy Mondays, Tasty Tuesdays, things like that. So students could still enjoy, life, but would stay on campus. Now, if we found students who were leaving campus kind of irresponsibly, et cetera, we had all kinds of stepped up, first, you can't do that. This is why, explain. Second, restorative justice. You're gonna have to talk to your dorm mates because you went off campus and this, that, and the other. And there were probably 1 or 2 times where there was enough of an egregious situation that we told the student that they needed to be quarantined for 14 days because they might have had COVID and we don't know. So that wasn't like kicking them out of school, but it was a public health measure they could have increased the risk to everyone. So they will be quarantined. 14 days, take their stuff on Zoom. And that was enough of a punishment that they did not want that. They did not want to be in that kind of situation.
Now, suppose that you were the president of Chicago State University,
Yeah.
or a university that just did not have the resources of a Vassar.
Yes.
What are some things that they can do, and what are some things that they probably couldn't do that would be important?
I mean, I worked with a lot of the other colleges in New York State. I was part of Cuomo's New York Forward reopening committee. And as a result, really was involved in writing the guidelines for New York State's higher education response. So those had to be written in a way they could be implemented by even a state school or a city school, a community college that doesn't really have that many resources. So a lot of the things that we could do, they couldn't do, like they really couldn't manage that much testing because testing is expensive. Although insurance typically pays for it. So we thought it would be expensive and then ultimately it wasn't that expensive. But they also couldn't manage to sort of stay on campus because they're usually in their commuter, a lot of people coming in and off. So in that case, I think they needed to, a lot of them had more COVID than we did. That's one thing. There wasn't that much more they could do. That was the impact, but they had to really work on the behavioral side, more Zoom meetings, fewer things on campus, more alternative work schedules, earlier telework. Then we didn't do telework until this fall. A lot of other places did it a lot earlier. So I think they had many less choices than a campus as Vassars.
By the way, and just in terms of the teaching mission, were there innovative practices that people did during COVID that in God willing will be in the post-COVID time that you expect will be incorporated in post-COVID teaching and or regular activity?
Yes, everybody's Zoom skills got exquisitely better. The whole being able to do your office hours online, that has stayed. Faculty will just jump online if they need to talk to someone before the papers due now. It's just much more access. We also put a lot of our mental health services online. Students loved it. They thought that was so much easier. We had a virtual student admitted day, and we did a lot of virtual tours of the campus because no one could come to campus. Those are so useful now because, we can get to that many more people and we can actually see the whole campus now. We have a nice video that people can see the campus without being here. So I don't know if we ever would have invested in that if we didn't have to. We also did virtual commencement. And so that was really interesting because now maybe we'll think about for families who really can't make it here, we can do some extra things that make them really feel like they're part of the campus, even though they're remote. In the classroom, we had people do incredibly creative things. Someone figured out how to send kits home so they do gene splicing in their kitchens at home. I try not to ask too many questions about that, but I do think the ability for the flipped classroom, so many more video pieces that you could put into a class that they didn't know. Guests, are now zooming in right, left, and center in classes, and we just didn't have our classrooms weren't set up for that previously, and now they have cameras and microphones, and all of that will stay for sure.
It does seem the idea of bringing in a guest lecturer who, that you could do a Zoom, if you were going to come to my policy analysis class, rather than make you schlep to O'Hare Airport and whatever,
Exactly.
that just, it's an hour and a half,
Right.
we'll put you on Zoom and
Right. What were we thinking all these decades? I know we've learned a lot, no question.
There, are there institutional capacities that you think? So you mentioned having an organizational psychologist.
Yeah.
Are there if we gave, if some donor said, I'm going to give you, $5 million a year,
Yes.
do something to build a new organizational capacity that the Vassar hasn't had.
Yeah.
Coming out of COVID, what would you ask that donor to spend that money on?
Yeah, this may not seem like it's relevant, but I think it's totally relevant. The capacity we only have a little bit of that we need a lot more is our ability to do restorative justice, our ability to do interdialogue groups, because so much of organizational resilience has to do, as you said, with the relationships that are already there about difficult issues. And that's why I say this is also about so much diversity, because we have diversity, the racial issues, the religious issues, the socioeconomic issues, the political issues, but there are also the health issues. And I think if we had greater sort of ability to set boundaries and then do restorative justice when those boundaries are traversed inappropriately, we'd be a lot healthier. We'd be a lot healthier as a nation, but I'm just looking at the school right now. And I think those capacities really save organizations. So we're looking to build those more and more, have them in nascent areas, but how to make that a skill you graduate with, I think would be terrific.
There a couple more questions. One is if I can jump back to public policy. So you mentioned, and I mentioned, that state and local public health are very underfunded. And then of course, there's nothing more irritating than hearing people in Silicon Valley saying that the state health department or that some small city health department should really have $1 billion IT system that would be so much nicer than sending faxes, because of course no one ever figured that out on the local level. We pay for Medicaid through a federal matching program. Every time Illinois spends $1 on Medicaid, federal government throws in $1. Should we be financing state and local public health with a similar matching formula that's like the FMAP that we use in Medicaid?
I think 100% yes. If we could actually do that without crowding out all the other investments that are, without crowding out Medicaid, I think that would be tremendous, tremendous. And I think you would have the issues about how the counties get it. So it's a little bit easier with Medicaid because it's a state program. Most public health is happening at the county level. So I think negotiating how the city, county, and state public health resources are adjudicated, that still would exist. But to be able to have a federal match to what the state would put in, I think really could be very transformational. And
then a strange question, but one that was brought to mind by your presentation. So a lot of us who take on academic leadership roles, we sometimes come into those roles because of our academic accomplishment.
Yeah.
And then we find ourselves managing large organizations. Yeah. In what way is it helpful, and in what way are there dangers or blinders or whatever that come from being an accomplished academic when okay, now I'm running I'm running an organization with $1 billion endowment.
Yeah.
How have you, I'd be curious for your reflections about that, especially since you faced this huge challenge with COVID. Now, how long were you president of Vassar before this challenge hit?
I started in July 2017. So what is that, 2.5 years?
So you were there long enough.
I was.
But I'm curious your reflections on that aspect.
Yeah. I've thought a lot about this actually, because I have always been in, I have an MBA, I trained in management. A lot of my research is on organizational behavior, and I did a lot of leadership development work in my global health work. So I've thought a lot about the management capacities versus the typical academic capacities. And I think the danger or liability that academics who have published 400 papers and they're getting all these R01s and then they start running thinking, I think the major thing that academics in that situation face is, in academics, there's a certain amount of certainty. There's a certain amount of cause and effect. There's a certain amount of statistical regularity that just does not occur in real life. And I think the ability to think broadly and get this, like everything's connected to each other, and to really respect management, because that's the other thing about, like physicians, academics are independent, they're autonomous, they get their prestige by being big in their professional association and maybe getting a chair, this, that, and the other. They are not big institutional survivors. They're not like they're about their fiduciary responsibility, if you will, is kind of to the student and maybe to their profession rather than to the organization. Whereas a manager, their responsibility is to the organization and its survival. So an academic coming into that, I know I'm a manager or a director or a leader or whatever, that is tough. It's like they're changing their people, they're changing their loyalty. And I think being explicit about that and getting a lot of experience and reading a lot about it is really helpful, and having, organizational management experts around an academic who's starting. My board is fabulous. I love them. And they have put every resource in front of our management team to allow us to, get clear job descriptions, be sure we do salary grading properly, be sure we've got our sort of management systems and reporting systems clear. They've been really supportive of the investments needed to have good management in an academic environment. And I think we've all benefited from that.
I must say, I was struck as you were saying that when I got my master's in public policy, I never had a class that taught me how to hire or fire anyone, or how to write a job description.
Yeah.
A lot of the idea that everyday management is that the cognitive challenge and the need to bring your A game and mental, all of the tools to that just as much as to your research.
Right.
That was not something that I was socialized to.
Right. Yeah, I think there is a great opportunity for leadership development for chairs who want to become deans or provosts or presidents. Just like physicians, we've spent a lot of money on physician, management development. If you're going to be a chair, often you'll go through something, but have thought less about that, I think, in the general academic sphere, which I think it's needed to help us all a lot.
So that may be one of the things we can learn from COVID, because we do have, we are in a major institution, where the University of Chicago is $1 billion institution, and we are key leaders in it. And we need to think about our management responsibilities there as something that is more than just a chore that has to be done.
Right. And you have a great business school there, if I can just shout Booth out, where I went, that knows a lot about this stuff. So collaborations, I think, are key.
Yeah, there's a lot of blinders in the business school culture, of course, but there is this reality that we will be running an organization, and we have to think about strategic management as that's one of the ways that we protect the human beings that we work with, is we are good managers. And being able to write a great op-ed in the Washington Post about what policymakers should do that's only one piece of that. What have I not asked you about that, as you're listening to the conversation, you're like, this is something that really I want to mention?
I guess I would just say, for people who are thinking about taking on a role like this, or you get foisted into it, one thing that has really helped me is just finding the sanctuaries of your friends and other people who you can really trust to sort of keep you solid during this time. And I think often as academics, we're very cognitive and we're less emotional. We're like all about, okay, well, whatever, I got to get to my regression. And it is just a really emotional job and an emotional time. And it is about, generating human flourishing. That is an emotional thing. And I think all of us need to, need to be aware of that and realize, all right, I got to take care of that side. Otherwise, just like the frontline workers, we fry also. We can burn out also. But I think with the right, conscious thinking about the mindfulness and the gratitude that goes with being able to lead like this, we can get through it.
Well, that seems like a very fitting place to end this conversation.
Thanks,
I thank you so much, and thank you for the leadership that you've provided. It's been a really enriching conversation. And thank
it's
you,
really
everyone.
nice to catch up. Harold, I really appreciate all the questions and catch up, and let's get together physically soon sometime, not just on Zoom. And to the audience, thank you all very, very much, and feel free to be in touch. And thank you, Keith.
Thank you, everyone.